My name is Dr. Mzee Ngunga. I'm a cardiologist. I work at the Akan University Hospital where I do clinical work. I also do a lot of training. I'm in charge of the cardiology fellowship training program, and I'm part of the faculty of the Department of Medicine. I'm also currently the president of the Kenya Cardiac Society, and I am happy to be here at the KFP conference in Mombasa. Technology in cardiovascular disease is part and parcel of modern medicine. Gone are the days when patients were seen as separate from technology, and now we doctors have learned to embrace technology as part of our practice, and indeed we are not only embracing it, but we are also passing it on to our trainees and indeed to our patients. So you will be seeing more and more of our patients coming to our hospitals with devices and technology that they are utilizing to collect information, and they expect you as physicians to help them interpret it and to make clinical use of it. So it is true, doctors are going to be interrogating more and more technology in the future than it has been in the past, and it's going to be part and parcel of them. And the same technology we are going to see transitioning from just simple to more complex into what we are calling artificial intelligence. Correct. So mobile technologies are going to be even more common, because there before we have used telephones for communication, social media, but we as doctors also need to infiltrate that space. We need to use the telephone as a tool to enhance health, because these diseases they are called chronic diseases. That means people live with the disease and they also live with the risk factors. So we can actually utilize these devices to talk to our patients in the same way as we talk to them in social media. And we want to talk in a way that is enticing and in a way that is encouraging, and the one which moves them change their ways of life, to improve their ways of life into targeting, into getting to those habits which actually improve their risk factors. For example, what should they eat? How much they exercise? How much are they walking? If we talk to our patients this way, they are more likely to accept these technologies, and we shall see a reduction in heart disease as we engage our patients in better ways. Yes, that's a very good question. So we are going to see more and more devices being used, and we are talking about what we call non-wearable and wearable device. The most common non-wearable device is a cell phone, because a cell phone is common in people's pockets. What does it do? They are always moving with it. So you can actually use it as a step counter. You are there when you are eating, so you can tell it, this is what I have eaten, how much calories have I taken. Whenever also the kind of food you have eaten, it will tell you, is this a good food or bad food? Because these are the things which you are going to do. What you eat today determines how your health will be in the future. So whenever you put all that information in the phone will tell you, from what you are eating, things are likely to get worse. And this phone is with the patient all the time. So the non-wearable device comes in very handy. And these apps are with the patients all the time. So we want to encourage them to use them, because they will shape their future, and we want their future to be heart healthy. What about the wearable ones? The wearable ones are like the watches, for example. If I can put that way, the watch is the commonest. There are others that you can implant on your skin, which are less common, but the watch is the most common. Why is the watch better? Sometimes the watch is used all the time. Even when you are sleeping, you are asleep with the watch. So they can actually tell your heart rate, not just when you are walking, but also when you are sleeping. It can tell you about your oxygen. So these wearable devices tell the patients, your oxygen was very low at night. When they thought then they can understand, that's why my sleep was not very good. So wearable devices are also coming in handy. Why is this important? Because we have seen people invest in so many complex things, but we also want them to invest in their health, because their health, what they do today will determine their health in the future. And these are some of the things we want our patients to move with. We have seen from our research that heart disease is occurring in young people. So it means these young people need to be educated, so that we can move this trend from young people to probably later in life, where the repercussions are probably less compared to when it occurs to young people. Yes, and that's why we are talking about not just individual, but community interventions. So the watch and the phone are part and parcel of your health. As I've mentioned, We can use the phone to tell us what you are eating, how much you are walking. You can record your blood pressure numbers. The watch will get your heart rate, even when you are not watching. If your heart rate goes bizarre, it will tell you, oh, something is happening. Because it is recorded and they're usually very correct. And you can seek a doctor's advice even before you feel anything, because some things occur at night when you are not feeding. So it is true, these devices, people can invest in them, just as we have seen people invest in anything else in their lives. People invest in houses. People invest in so many things. But indeed, these devices are actually useful, just like anything else, and it is part of your health, not just now, but also in the future. My parting shot is to my fellow doctors and colleagues, and to our patients. Please invest technology into your health life, because it is going to determine your health not just now, but indeed in the future. And it's going to motivate you and encourage you to be a better you in the years coming. Bye.